Hi, Professor Ben Cowie. Thanks so much for joining us again as a follow-up to our Yarra Community Forum that we held on the 8th of June. It's really great to have you back, and we wanted to welcome you back just to answer a few questions that community have ongoing about the vaccine. Before we start, I'd just like to acknowledge the traditional owners of the land in which we're meeting today, the Wurundjeri people, and pay our respects to elders past, present and emerging. And so, Ben, I just wanted to give you the chance to give a brief update about the AstraZeneca vaccine and the changes that we've seen in the last week, please.
Absolutely, Laura. So thank you for the opportunity to be here and to have more discussion with you and your colleagues there and with members of the community who have got questions. I'd like to acknowledge that I also am on Aboriginal land. I'm on the lands of the Bunurong people of the Kulin Nation. I acknowledge their elders past, present and emerging. And yes, more changes in the last couple of weeks, Laura, absolutely. So the week before last, the ATAGI recommended to the Commonwealth Government that the age at which the Pfizer vaccine is preferred should be increased. Previously, it was people up to the age of 49. Now it's people up to the age of 59. So this means that we are now offering Pfizer vaccine to anyone who's eligible for vaccination up to and including age 59 years, whereas for people aged 60 years and over, we're continuing to offer the AstraZeneca vaccine. A couple of important points there. Firstly, people who are eligible, who are under the age of 60, are still able to ask for AstraZeneca vaccine at our state commission services once someone's gone through the consent process and an examination of their own personal decisions about risk and benefit are made, they can ask to receive AstraZeneca. Now we have many hundreds of thousands of Victorians eligible for vaccination under the age of 60. This means, and we're only receiving a fairly limited supply of Pfizer vaccine nationally. This means that it will be some weeks before people who are currently eligible for vaccination will be able to access it for many people, which is something we're continuing to work with our colleagues in the Commonwealth to try and improve access. But it is absolutely the case that we would love to have more doses of Pfizer available to give to people who are currently eligible, but the supply is very limited.
Okay, and it's really good for us to know that certainly in North Richmond, people that live in public housing, so the high-rise towers or low-rise and any other sort of identified vulnerable areas will be now eligible, and they can come and seek that vaccination from us. Can you, Ben, please just talk in simple terms about how the vaccines work, just briefly? Yeah.
Of course. So both the AstraZeneca vaccine and the Pfizer vaccine, they work in a similar way. Essentially, what they're doing is providing a template or like a recipe to our immune system. And that recipe, where that actually causes our immune cells to make a protein or a molecule that looks like the outside of the virus. And then our immune system recognizes that and responds to that, so that if that person comes into contact with the actual virus at some stage in the future, the immune system has already seen the outside of the virus before and can fight it off. And that's how the vaccines work. Whether it's Pfizer or AstraZeneca, it's the same sort of outcome.
Fantastic. That's a really, really good explanation. I've got a strong visual there. You know, a lot of people think that the Pfizer vaccine is better than the AstraZeneca vaccine. Can you talk about that?
Yeah, sure. So it depends. When we talk about a vaccine being better or worse, what a lot of people are talking about is a word that gets used a lot, which is efficacy. And efficacy basically means how good is the vaccine at protecting against the infection we're talking about. So the way we talk about efficacy, it is really important to understand what we're talking about the vaccine preventing. Is it all infections? Is it getting sick from COVID-19? Or is it getting seriously unwell, ending up in hospital or losing your life? Now, for both AstraZeneca and Pfizer vaccine, they both work to prevent all of those outcomes, from getting infected in the first place, from getting sick, or from getting really, really unwell and ending up in hospital. It is true that in the clinical trials, protection against getting sick with COVID was slightly higher for the Pfizer vaccine than for the AstraZeneca vaccine. So in the original studies, about 95% protection against getting sick symptoms with COVID for Pfizer versus 80% for AstraZeneca, if it was spaced by the appropriate 12-week spacing that we use in Australia. However, it's really, really important to know that the population level information, so looking at what actually happened when these vaccines were used across, for instance, the whole population of the United Kingdom, is that they're both about equally effective, 90% protection for both AstraZeneca and Pfizer against serious illness, against ending up in hospital or losing your life. So about the serious consequences of COVID, they're equally effective. And that now also we have data that includes with Delta virus. After the second dose, 90% protection against ending up in hospital or getting really sick. So
really
this is really good information.
Particularly with the media talking about the Delta virus and how contagious it is. And I know that in this room we've all been vaccinated, and so it is a really important message that all of our community get vaccinated to ensure that we have maximum vaccination rates and that herd immunity that we hear that's thrown about a lot.
Absolutely. Ben, it's great to see four Victorians on the other end of the line here. It's wonderful to see. Absolutely. Congratulations to all of you.
We love being Victorians. Are there any long-term side effects that we know about from getting vaccinated?
So not that we know about, not ones that present after that first initial period following vaccination. Clearly, there's been lots of discussion about different side effects with both the AstraZeneca and the Pfizer. There's no reason to suspect that there will be long delayed side effects from these vaccines based on our knowledge of the vaccines and how they work. But we can't be absolutely sure because we've only been studying these vaccines over the course of the last year. So is it possible that very rarely there may be something that comes out in the future? That's always possible. Sure. But what we really do know is that there are definitely long-term side effects of COVID infection. And more we're realizing this long COVID, or people who even after months and months after having COVID still feel really unwell and not back to normal. That is very true. Yes. So that the side effects that can have long-term consequences, things like, if someone does get a severe allergic reaction or gets, for instance, clotting from AstraZeneca, that can last for some time, the consequences of that. But the consequences of COVID or the results of long-term results of COVID infection can be very severe too.
Okay, so, really the risk of getting COVID, long-term and even short-term are much greater than the risks we're seeing from taking the vaccines. So that's a really important message for our community.
Absolutely.
Some people say, I have other health problems, I have other things that are wrong with me. Should I get the vaccine?
So the best person to talk about your own health and about vaccines as they relate to your health is your regular healthcare provider, your nurse, your GP, your community health worker. But it is really true that we saw people with other medical problems end up in hospital much more commonly with COVID than people who didn't. We know that having things like underlying heart disease, underlying lung disease, or liver disease, or having diabetes, having had a diagnosis of cancer, these are all associated with very significantly increased illness and hospitalization and loss of life from COVID. And that's not just in Australia, that's worldwide, which is why in that whole prioritization, choosing who gets vaccine first, people with other medical problems were brought to the front of the queue because we want to protect their health with these vaccines. So really, some of the most important people to get vaccinated are those with health problems.
Sure. Okay, and we do, I know our community staff, you know, we always encourage people to go and have a chat with their nurse or GP, so we will continue to do that. And what about if you take other, you know, if you use drugs or you take other medicines, is it safe to be vaccinated?
Yes, look, at this stage, really, there's very, very few situations where any medicine have any bearing at all on the vaccine. It is true that someone who is on medicines that suppress their immune system, so someone who might have an autoimmune condition or where the immune system is causing problems and they're on treatment to suppress it, the vaccine may not work as well, but it's not unsafe. These are not vaccines that cause infection. It's impossible to get COVID from the vaccine. So it's safe to be vaccinated in that setting, but it may not work as well. And like anything, again, really good to talk to your health worker about any concerns about medicines and how they relate to the COVID vaccine.
Okay, thank you, Ben. And what about, so we now know that for some people, if you're 16, you can now get a vaccination. 16 and 17-year-olds can now get vaccinated, which is really exciting. Do they need to get consent from their parents to do that?
So for the most part, and this is spelled out in the consent forms, etc., it comes down to whether someone is considered to be an adult at law. And so for 16-year-olds, for the vast majority of cases, someone is competent to give their own consent to vaccination. And that is spelt out in the sort of consent guidelines around the vaccine.
Sure. Okay, and we go through all of that consent when people come to the clinics, any clinic for vaccination. Thank you. And why can't people have Pfizer for their second dose if they've had AstraZeneca for their first dose?
That question comes up a lot. And the sort of medical answer to that is that it is both safe to have the second dose of AstraZeneca, and we don't have enough information yet on whether it actually builds the same amount of immunity in people who mix and match, have one vaccine and then another. We certainly know from some studies overseas that the antibody responses, so doing a blood test to see the immune system react, that looks good if you do have a different vaccine on the second dose. But that's not good enough for us to say we should do that. We actually need evidence that it protects against real infection and has the same sort of protection against ending up in hospital or getting seriously ill or losing one's life. And we don't have that information yet. Once that information becomes available, it is the case that our Therapeutic Goods Administration, the TGA, who licenses the use of vaccines and medicines in Australia, will examine that evidence. And if they say it's okay to mix and match, then the policy will change.
It might change. It's a very fast-moving area. And I suppose, but what we're saying is that if someone didn't develop a blood clot after their first AstraZeneca, with the risk always being very low, then it's highly unlikely that they would then go on to develop that in the second.
We've never seen it in Australia yet after a second dose. So the recommendations from ATAGI, the Australian Technical Advisory Group on Immunisation, and from TGA and from us and from all of the sort of really the public health bodies is if you've had your first dose of AstraZeneca, doesn't matter how old you are, please get your second dose. I got mine a couple of weeks ago. I was excited to become a full Victorian. And honestly, we know that especially with the Delta strain of COVID-19, having your second dose of vaccine, whether it's Pfizer or it's AstraZeneca, is so important. So people should get out there and get their second dose.
Great, that's a really good message. Tell me about, a lot of people in community are asking, does the vaccination cause infertility? Can you talk to that?
Absolutely. It absolutely does not cause infertility. So these vaccines, the substances in the vaccine, that little recipe to give you immunity, it doesn't have any impact. It goes nowhere near the parts of the body that produce, that are involved in the reproductive system. It has no impact on fertility. And in fact, it's perfectly safe during pregnancy and breastfeeding to have, and particularly with pregnancy more recently in the last few weeks, it's been recommended that pregnant women receive the Pfizer vaccine. So absolutely no impact on fertility or on breastfeeding. And now it's recommended not just by immunization people, but by obstetricians and gynecologists. The college that actually supervises obstetricians in Australia has recommended pregnant women get vaccinated.
And that's fantastic. And what about if you're a breastfeeding mother, does that offer any protection to your baby?
Yes, it's almost certainly that it does. We don't have a lot of evidence yet at the degree of protection, but it's like any other vaccine or many other infections that women may have had, that they produce those immunity that actually gets transmitted to the baby during breastfeeding. And it's part of how a mum can protect her baby. And one of the reasons why breastfeeding is such a good thing for babies. So yes, it is true that antibodies against COVID can be passed in the breast milk and then protect the baby, but we don't know how strong the effect is yet. Sure.
Okay. And is the vaccines, or are they halal, the Pfizer and the AstraZeneca vaccines?
So I'm not an expert on what is and what isn't halal, so I don't presume to state on my own opinion, but I know that the opinion of many religious authorities, the Muslim Health Professionals Association of Australia has come out saying that the vaccines are halal. And I understand many other leading authorities globally have stated that the vaccines are halal. But that's clearly not for me to say.
Yeah, of course, thank you. And sometimes people who are, unsure about the vaccine have read some things about the vaccine being microchipped. Can you comment about that?
Yeah, absolutely not. There is nothing in the vaccine that can track the person, or there's no microchips, there's no sort of secret signals or anything like that. Yeah. I understand. Look, some people think that these questions, they laugh when they hear these questions. I think it's actually quite serious. It shows how concerned people are, and it shows that people don't trust some, whether it's the government, whether it's other groups, they don't trust. And I understand that's often coming from a place where they've had some bad experiences in the past from government. So I don't think it's something to take lightly. Yeah. But I can guarantee there is absolutely nothing in these vaccines that could be used to track or control or in any way sort of monitor someone going forward. It's absolutely nothing like that in there.
Thank you. That's really important. We know the vaccine's not compulsory. We are encouraging people to get it. It's not compulsory. Why should people get vaccinated?
What a big and wonderful question. Let me be very sort of simple about the answer.
Yeah, sure.
Firstly, we've seen overseas the tragedy that happens when COVID-19 really takes hold of a population. And in many of the countries where we have family or friends or colleagues, the devastating impact of COVID-19 in terms of people losing their lives and people getting really sick is a horrible thing to see. But we've also seen in many of those countries where vaccination levels have really ramped up, we've seen the loss of life, the hospitalization, the huge pressure on society dropping away so fast. Taking one country as an example, so, the United Kingdom, where we saw for people who had their first dose of vaccine, that hospitalization dropped away by 90% within the weeks after people started getting their first dose. And it's in many other countries, we've seen the same thing, that just the devastation, that the health consequences have dropped away so fast. So that's the first reason, because it saves lives and it saves people from getting ill and from passing it on to their loved ones, because we know the vaccines block infection going to other people, significantly do. The other reason is that the higher the levels of protection we have in our community, the faster we'll be able to open up, and that we'll not have to be in the same sort of lockdown situations, and we won't have to have the same sort of restrictions on our freedoms. We'll be able to travel again. And that's because we'll be safe. The vulnerable members of our community will be safe, we'll be safe. so we can get back to as normal a life as we possibly can. So there's just a couple of the really good reasons why we should get vaccinated.
Very encouraging reasons, thank you. And I suppose this touches on the next question, which is, you know, if I haven't been vaccinated, do you think going forward, I mean, obviously it's very difficult to go overseas at the moment to see family. What do you know, do you have any thoughts on where the government might go with that? So if you haven't been vaccinated, do you think you'll be allowed to go overseas and see family, you know, next year, for example?
So I think there's two aspects to this. I think it's very likely that we will have vaccine passports, that someone who has been vaccinated will be able to travel, whereas someone who hasn't won't. I think that's very possible. I also know, or I suspect, I should say, I expect that until a certain proportion of the population are vaccinated, as we find out more about the degrees of protection, it's unlikely anyone will routinely be able to go, even if they've been vaccinated. So for individuals to be vaccinated, that means they will have more freedom. But the higher the levels of vaccine in the community, it makes it more likely that any of us will be able to travel. Because again, the last thing we want to see is the kind of scenes we're seeing right now in many parts of Australia, where COVID-19 transmission is occurring and states are clamping down on the public health restrictions again. The only way to stop that happening is to get more people vaccinated.
Sure. So we have a responsibility to protect, you know, to protect ourselves, to protect our family and friends, and also to protect the greater good of, you know, Australia and our freedoms, as you say. So it's a really important thing to do. What about, some people say, you know, I'd like to wait until the end of this year to get my vaccine. I just want to see what's happening. What would you say to them?
I would say that some of the people who are currently living with COVID-19, who have been infected in the last week around Australia, may have had the same philosophy.
Yeah.
You know, we are not out of this. You know, Melbourne and Victoria have had a different experience from the rest of the country, but now we're looking at New South Wales.
Yes.
We're looking at Queensland. We're looking at the Northern Territory. We're looking at Western Australia, all of whom now have cases of COVID-19.
Yeah.
This is going to keep happening. We also know that the proportion of people who are currently cases, you know, around Australia, who have we're seeing that this is really happening amongst unvaccinated people. Now, they may not have been eligible. Some of them were, but it is absolutely the case that if you wait, you're putting yourself at risk. And the earlier you get vaccinated, the safer you are.
Okay. And I mean, in Melbourne, we have just, you know, come out of an outbreak, another outbreak in the 4th lockdown that we've seen. And I think it's fair to say that with all the threats to our border and in other states, what's happening, we're probably, you know, looking at another outbreak. So it is important to get on and be vaccinated.
It's a race. There's no question it's a race. And it's a race against the virus.
Yeah. What about for someone that's had their first vaccine somewhere? Can they go somewhere else? What do they...
Yeah.
Get it done somewhere else? Yeah.
For sure. So
yeah.
My first dose was at the Austin Hospital at the Heidelberg Repat, and my second dose was at a GP near where I live. So absolutely, first dose GP, second dose state system, first dose state system, second dose GP, doesn't matter. Different state system, different GPs, whatever you want.
Okay, and just bring your evidence of your first vaccine dose along with you if you've got that. Ben, final question. There are a lot of people talking in the media about the vaccines, and it's all very confusing. Where can we get the most accurate information and in-language information about the vaccines and COVID-19?
Yeah, I agree. There's a lot of information, and some of it's good, and a lot of it's not really that good. And it's very confusing for people, I understand. So both the Australian government website and the Victorian government website have information on coronavirus and the vaccine that is 100% accurate. We're continually updating it, and is available in a range of community languages. The other really important people to go to for accurate information is your usual healthcare provider, because our fantastic nurses and GPs, we're working with them to keep them up to date and to give them all the more recent information. And for many people in the community, They might look on what the government says and not be so sure, but they really trust their own doctor or their own nurse or their own health worker. So those people are also fantastic sources of information for the community.
That's excellent. Thanks so much, Ben. And thank you so much for coming and meeting with us again. And we'll be sure to share this message widely and yeah, wishing you all the very best.
Thank you so much, Laura and colleagues. It's been lovely to talk to you all again. Thank you so much.
Thank you.